Hi again, this is Dr. Rob DiMartino, and as the head trainer for one of the largest national healthcare consulting firms in the country, and owner and presiding doctor over my own neurologic relief center in Henderson, Nevada, just outside of Las Vegas, I wanted to take some time today and make this video about a very misunderstood condition, and a condition that's affecting more and more Americans and more people throughout the world, and that condition is fibromyalgia. Fibromyalgia, like I said, is very misunderstood, and unfortunately, it's incredibly difficult to diagnose. The diagnosis is simple enough, is what you're talking about is you have to have pain in 11 out of 18 spots in your body that contributes to the upper body, the lower body as well. It has to be 3 months in duration, and it has to also be including fatigue and or depression. Unfortunately, unlike other arthritic type of diagnoses like osteoarthritis or things like rheumatoid arthritis, there's no blood test that you can do. Like rheumatoid arthritis, you do a blood test, it says RAB27 in the blood, you got rheumatoid arthritis. They can't do a blood test for fibromyalgia and say, oh, you have fibromyalgia factor in your blood, you've got fibromyalgia. Unfortunately, it's what we call a disease of exclusion, meaning they exclude everything else out. Well, it's not this kind of arthritis, and it's not that kind of arthritis, and it's not rheumatoid arthritis. So, you have chronic pain, it's all over your body, you must have fibromyalgia. And unfortunately, what happens with that, and if you're one of these people, I will tell you that I'm truly sorry because I see this every single day in my practice. Eventually, at some point, if you're suffering with this, you've probably been told it's all in your head. Because there's no real way to track it down and truly diagnose this without just trying to move everything out. And if you've been told that, I'm sorry. Because unfortunately, I find it more and more with the patients that I'm seeing. The reality of it is, and I can tell you this, I know you don't know me that well, and I know you're just taking my word for it, but I can tell you from the heart with total honesty and truth, this is a very, very real condition. This is not something that's in your head. This is not something that's made up. There's been a tremendous amount of research on it. We've seen a tremendous amount of patients with it. This is a very real, and sometimes it gets down to a very debilitating disease process. And trust me, I watched all the videos. I read all the research. I know what all the trends are. And a lot of them, there's some truth to. And a lot of them just promise a miracle cure. Well, unfortunately, I hate to be the bearer of bad news, but you probably already know this. There's no miraculous cure to fibromyalgia. However, as time has moved on, we now have ways of actually treating it and getting good results. It's not a magic bullet, and there's no such thing as a magic pill, potion, or lotion that you're going to rub on that's going to make it go away. But through the research, we know what physically causes these things. We know what chemically causes these things. We know hormone imbalances are involved as well. And taking this more overall body, more natural type of approach, people with fibromyalgia have been able to see significant results. If it doesn't completely go away, they're getting their quality of life back on some sort of level. And for most of them, that's more than enough. I see patients who come in, they tell me their pain's 10 out of 10. Well, guess what? What they tell me is they don't want to be 0 out of 10. If they were 3 or 4 out of 10 every day, they could live with that and probably have the happiest life that they could have. But here's the thing. This is something that can be done. And there's new breakthroughs in neurological techniques, some of the things that we're using in our clinic, that have shown profound results in helping with fibromyalgia patients. First off, let me define what new means. New in the world of medicine means this is about 10 years old. We don't move too fast in medicine, but this is what we're talking about. 10 years old, it's new, but it doesn't mean it's not tested. There have been thousands and thousands of patients who've gotten treatment with this and gotten massive results. Again, I'm not saying that this works for everybody, but what our advantage is, within all of the other testing for chemical toxicity and things like heavy metal poisoning, which has been reported in the Journal of Rheumatology about 2 years ago now, or adrenal testing, or hormonal imbalance, or thyroid imbalances, which is a very common diagnosis within fibro as well. The neurological component of this has been something that's been of a mystery. Because in the past, there's been no test, no imaging, no MRIs, no CAT scans. They know that the brain tends to atrophy and get a little bit smaller, but they've never had a reason as to why that happens. Because there was, again, no test to find out why that is. Now, about 10 years ago, there's become a test that's developed, and it's a 5 to 15 minute test. And the most unique thing about it is, by taking pressure off the central nervous system, If you feel a reduction in pain, that means you have this problem and it's something that the procedures will work for you. Let me go over that again. What you're talking about here is very different than any other medical test that I can think of or that I even know of. Because the result isn't found by me, the doctor. The result is given to us by you, the patient. If you feel better with the testing, then the treatments will work for you. If you don't, then we have to dig a little bit deeper. That's not your problem. So for us, it becomes a very easy way to say, yes, we absolutely can help you, or no, I'm sorry, this is not the right step for you. We need to go and look someplace else. As a doctor, you have no idea what that means to us to be able to accept the patients we can help and not waste other people's time and money with the people we can't help. However, what I'm sure that means for you is proof is in the pudding. You feel better, techniques are going to work for you. If you don't, it doesn't mean you're out of luck. It just means we've got to look in a little bit of a different place. And not everybody responds the same way. You have two people with fibromyalgia, you put them in a room, there's no box with fibromyalgia. That's the important. We want everyone to fit into this nice little contained box. It doesn't work that way. Everyone's different. They're going to have different causes. They're going to have different reactions. They're going to have different symptoms. Some of them have no fatigue at all. They're what we call functioning fibromyalgia patients. They run around, they have all the energy, they get through their day, but they don't feel well doing it. Some are so tired they can't even get out of bed in the morning. Everyone's going to react differently with this. But once neurological control, it's kind of the missing link that's been involved in fibro, and all this other stuff works, the free radical damage, all those things, it does work. But what most people find is it takes them to a certain plateau, and if they don't keep going with it, they go right back downhill. Or they go up to a certain level, and then they peak and they can't get any further past that. This can be the missing link for people who've had that issue happen to them before. What will happen is when your neurological function isn't correct, meaning the central nervous system, the way your brain, fibromyalgia is a disease of miscommunication. Whether your hormones are telling your body to react in a way it shouldn't, whether chemical toxicity is causing your body to react in a way it shouldn't, whether the way that your brain is sending messages to the tissues of your body is working or not working properly. So for instance, if your brain accidentally sends a message to the organs of your body to secrete hormones to make you wake up when you're about to go to sleep, then you have a little bit of a difficult time falling asleep. If the brain sends a signal to your stomach, and after you eat something, now your stomach doesn't react in the right type of way, well, then you get celiac problems, or IBS, or even just something as simple as acid reflux. If the brain starts getting signals back from nerve endings saying there's pain in a tissue, pain in a joint, but you look at that joint and that joint is totally healthy, it's because you can't find where that's coming from. The issue is because the nerves are sending signal from someplace else, and that's what's causing the problems. Again, please don't misunderstand. I'm not saying that this is what affects absolutely everybody with these problems, but most of them have some sort of neurological component underneath the surface. And what I'm saying to you now is this has given people answers to their problems, meaning, yes, it's not all in your head. It's giving them hope to look forward to, and it's giving them a tried and true tested method to see if these things would be right for them. Now, that being said, I make these videos for educational type purposes, but please, I don't care where you are. I'm in Las Vegas. I don't care if you're halfway across the country. If this is something you want to know more about, okay, please don't hesitate to contact my office. I will send you information. I will talk to you. I will do whatever I can in my power to try to help you. Please understand, if you take nothing else from this video, there is hope. Don't give up. Again, this is Dr. Rob DiMartino coming to you from Las Vegas, Nevada, wishing you wellness.